1470.
Talk 1470.
WNN. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home HealthCare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Welcome and good evening. I'm Yolanda Santana with NetSense, and you are listening to your Hometown Health Show, sponsored by Trilogy Home Healthcare. Today we have our special guest, Dr. France Ossi, and Dr. Mikhail Zelfman from VIP Physicians Consulting. Welcome.
Thank you for having us.
Thank you.
And we also have here Teresa Hilton from Trilogy Home Health, as well as Jackie Kelly and Brian Sykes. Welcome.
Thanks, Yolanda.
Thank you.
How is everybody?
Great.
Terrific.
Fantastic. Okay, so we're here to introduce VIP Physicians Consulting of Fort Lauderdale, which is now accepting new patients. Please tell us about yourselves.
Well, my name is Dr. Mikhail Zelfman. I've been in practice for over 10 years. I graduated from Nova University and I quickly became a board-certified family medicine physician. I worked both in the outpatient and inpatient settings. We worked, both Dr. Ossi and I worked in Trauma One Center and at Broward Health Medical Center, and we work at the I have worked in the urgent care community, post-acute care, and that's while working for over 10 years in those type of environments and seeing the patients who liked our care and the way we take care of the patient, who ask us to see if we can open an office so that we can take care of them, and that's where the idea came to open up our practice, VIP Physicians Consulting, where each patient is basically treated as a VIP patient.
Yes, to add on to what Dr. Zelfman says, my name is France Ossi, board-certified family physician, graduated from LECOM. The same thing, we've been doing hospital medicine together for about 6 years. And one thing we noticed was we wanted to continue serving the patients that we see and we take care of, from whether it's an acute trauma or someone who just had a tragic event. A lot of time they asked us, do you have an office? And that was the repeating question we asked. And we got tired of just saying, no, we don't. And a lot of the people we noticed were looking for new physicians. A lot of people without a primary care physician, someone to follow up with. Even some colleagues of mine always ask me, hey, do you have an office? I'm looking for a good doctor. And I think that's why we decided to, it's time to at least put together something different, but yet very catered towards patient care, being that we handle the critical care and the inpatient, but also to have someone they can follow up that they're familiar with, or someone that they can, build something with.
Okay, great. So then you do have an office?
We are currently opening up an office in the first quarter of 2019. The office will be in Fort Lauderdale.
Okay.
It'll be steps away from Broward Health Medical Center.
Fantastic. Okay, so you both have an impressive range of experience, over 30 years combined, it seems, earning your degrees from prestigious colleges and universities such as Lake Erie College of Osteopathic Medicine and Nova Southeastern, as you mentioned earlier. And now with the grand opening of VIP Physicians Consulting, how would your practice, or how does your practice differ from other practices that offer the same specialties? And what separates you? Mm-hmm.
I think what separates us from the other practices is a unique experience both myself and Dr. Ossi have. We both have an outpatient setting, seeing the patient in the outpatient and inpatient setting. We constantly educate ourselves and go to the conferences to find out the latest in the medical care and where the medical field goes, through the from now and beyond. And also we feel that right now we have a community in the need of good, experienced doctors, but who also are young enough to have an energy to take care of everything all the patient's needs. I am Russian American, and I go to the Sunny Isles and Hollandale area, Broward County, and Miami-Dade County, and there's a lot of patients, speaking Russian American patients who wanted a good care, and there is not that enough doctors, and that's one of the things that we can provide in that community, as well as everywhere else to every patient. And again, we're going to be treating them as if they are every single patient will be treated as our own VIP.
Yeah, and I want to add how we may differ from other maybe just outpatient offices, because that's the question I get asked, because I didn't just want to open up and just be another office in the corner, because there's plenty of them. I think having worked more hospital-based medicine, you realize why people keep coming back into hospital. So then working backwards, you understand what it takes to keep them out the hospital. But at the same time, you are available if anything happens to see them inside the hospital. A lot of times, a lot of doctors, they see patients outpatient, they don't see them inpatient, and this inpatient, they don't see them outpatient, or they don't want to be bothered with it. The fact that we can do both, and also we know what's lacking, the miscommunication, the social aspects of it, in working with social workers. A lot of times it's just a social need that the patient doesn't have the follow-up, or doesn't get their medications, or it's just too expensive. Working from the inpatient side, the critical care, you understand what it takes to get the patient home and make sure that they're following up with the medications, and try to deal with the barriers and challenges that they may have as far as like going home. And also to realizing a lot of times when we discharge these patients from the hospital, they sometimes cannot get an appointment for weeks and weeks with their primary. Then that's when they fall in the cracks, and then they're readmitted and things like that. At least with us, within a week or a couple of days, you'll have someone you can follow up with, and that way we'll make sure that once you discharge, you get an adequate appointment, and that way everything continues seamlessly.
And just to add on, I think both Dr. Osi and I, when we decided to open up the office, one of the number one things that we decided to do, that we're going to pride ourselves about, to be always available to the patients and their needs.
I think that's really lovely. I have to tell you, being in the home healthcare field for a number of years, it's one of the biggest complaints that we hear from patients, especially on discharge going home. So it's wonderful to hear a group of doctors that are really committed to that. And I think that is what separates you from the pack.
Yeah. Definitely. That's fantastic. I think everybody can agree with that. It's really hard to get appointments, and where you don't have to wait weeks and weeks.
And physicians that care enough to do the follow through and really, put that first. It's very nice to hear.
For sure.
Thank you.
So what advancements or modalities that your practice offers that our listeners should know about?
Well, we're going to be opening our office, which is very steps away from the Trauma One Broward Health Medical Center, which offers every modality that can be found. MRIs, CTs, lab work, and any specialty known. I have worked at Broward Health Medical Center for over 15 years, and I forged the relationship with all the specialists. So whether it's orthopedic, trauma, cardiology, vascular surgery. So we are going to be a biggest advocate for the patient, so that they can, whatever it needed to be done, whether it's a surgery, whether it's a diagnostic or radiological procedure, that it can be done in time, very efficiently, and we'll get the results right away, and do whatever intervention needed to be at the shortest period of time so that the patient can benefit the most.
Yeah, and also I want to add to that is the fact that also having cultivate those relationship with those other physicians in the hospital, and it's much easier for us to, for example, if a patient needs ultrasound, a mammogram, these outpatient or the pre-op clearance. And I think we're good with that. We work hand in hand with the surgeons that have same-day surgeries, whether they need something, as simple as just a hernia repair or a gallbladder or something. We work hand in hand to be able to work with surgeons and other specialists that probably needs a doctor to get clearance so the patients can come in and out, and that way they're not missing a beat also too. And for me, I'm big on health prevention, and I'm big on you making sure that we're not just waiting to go to the doctor just when something happens. From the hospital medicine, they usually admit it when something's wrong, but we're big on health prevention, education, doing outreach, doing health fairs, things like that to get out into the community and to educate as far as like things that those are preventable illnesses like diabetes, things that we can control, eating right, high blood pressure, high cholesterol, hyperlipidemia, things like that, once you diagnose with that and just follow the doctors, eat right, and nutritional information is big. I think those are key in the community. That way we keep a healthy community, and I think we go a long way with that.
I love that. Again, those are music to my ears, because that's what we try to do as well, as prevent hospital readmissions, people going back into the hospital. So that's wonderful.
Yeah, that's really great. On that note, we're going to take a quick break. You are watching your Hometown Health Show, and we have Dr. Frantosi and Dr. Mikhail.
Let's all welcome a new sponsor to the show. It's AMP2 TV, the first and only internet production company that's truly plugged in. When you're looking for a full-service internet TV radio production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make all your business selling points more powerful. They can do remotes or live radio streaming, as well as tape productions for social media platforms and television. AMP2 TV can handle all of your television needs, including closed caption for a perfect on-air telecast. Choose from a variety of creative TV and radio packages, or visit one of their many studios to get your creative juices flowing. Come and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's A-M-P, the number 2.tv, or call them at 866-224-5422. Feel free to call for a quote or just a consult of how to put your business on a social media platform or radio platform, or just doing a show that is covered by all platforms. Call 866-224-5422 and make an appointment. That's 866-224-5422.
Okay, we're about.
Hello and good evening. You're watching your Hometown Health Show. I'm Yolanda Santana with NetSense. And we have, again, Dr. Franz Ossi and Dr. Mikhail Zelfman with VIP Physicians Consulting, opening in Fort Lauderdale when?
First quarter of 2019.
And how can someone reach you?
Right now, we are going to be located at 500 Southeast 17th Street, Suite 301, Fort Lauderdale, Florida. We are in the process of getting on most of the insurances and also Medicare plans. So we will be getting out the information about when we actually going to open it and have an open house early in next quarter.
Fantastic. Okay. website?
We're working on the website as well.
Fantastic. Okay. So if someone wants to get more information, they
We'll
will
be able to take care of it.
Okay,
Yes.
and they'll reach out to
Or
Trilogy
you can
Home
call
Health
Trilogy
as well.
too. We have a 1-800 number for the show. It's 1-866-599-4959 if anybody has any questions after the show or needs a referral.
Okay. And so when you do open your practice, will it be by appointment only, referral, walk-ins?
Right now, we will be by appointment, but again, we are all about the patient and patient care. So whatever needs to be done, whether we find the patient, somebody is going to walk in who needs to be taken care of, whether we'll see somebody in the hospital and needs a follow-up appointment after surgical intervention or any other medical ailment. Again, we are going to be available and ready to help whatever needs to be done. We will be there for the patient and for our community.
Yes, and I agree with what he said, and also too, I want to reemphasize the point. A lot of patients we see, we do a great job managing them inpatient, but unfortunately, a lot of times when they leave our service, they don't have that continuity and the follow up, and I think that's where we want to kind of close that gap, so that way, those patients, if they choose to be ours, they can, and and we just want to make sure that if anything they would need, that we can address it. Some of them may not need much. They may follow up after the first week. We like to see them 1 week after discharge. Then after that, we might adjust certain medications or things they need. And then after that, they can follow us periodically. And I think a lot of times, too, is that when we have a patient, an inpatient, a lot of times there's some adjustments, and we like to make sure that if they're going to follow up with their primary, that we would like to communicate that, so there's not a lack of communications. And so if they still have their primary, we like to communicate with them, so that way our plan is continued. But a lot of times there's a miscommunication between the inpatient and the outpatient, so we want to kind of bridge the gap with those.
Okay, so there's definitely, like you mentioned, a gap between communication between physicians.
Yes.
And how do you bridge that gap?
Well, what we like to do is communicate. I've always instructed the patients to get the copy of your records. It's available. Take it to your primary if you have one. That way he or she knows exactly what we did, and also our numbers are listed on the chart, so they can reach us with any questions. And even before that, I try to reach out to the primary while they're in the hospital, just to give them a heads up that one of their patients are in, what we're doing, and why they were admitted, and this is what we're doing. So that way they have a heads up, and that way when they do follow up, then everyone could try to be on the same page.
That's really great to hear. I think a lot of times the information gets lost. I know I've heard repeatedly people go to their doctors and they, why are you here? Well, it was in the chart. I was there last time. Didn't it get put in the chart, So, yeah.
That's the truth. Can be.
And I also like to add that most patients, they don't only have just one ailment. They have diabetes, they have coronary disease, they have hyperlipidemia, they have history of stroke, and it's not like you have one patient and one disease. Most of the time they have multiple ailments, and they have to see multiple specialists. And when they see that one specialist, a lot of times one specialist doesn't know what the other specialist does. And whenever they change their medications, whether it's for nephrology and they change it to improve their creatinine levels, that can worsen their heart problems or affect their diabetes. So that's where myself and Dr. Osi will come in, will be captain of the ship, where we'll always communicate with all the specialists so that we are all on the same page and all trying to improve patients, and they're all going in the same direction. And to control the patients' symptoms. And again, just like Dr. Osi said earlier in the broadcast, preventing from the problem ever even occurring.
Right, and that gives the patients peace of mind. I can't tell you when you're at the hospital or even at a doctor's office and you're leaving, you want to make sure that your doctors are talking to each other and communicating and preventing that next episode or a hospital readmission. So that's a great point.
Yeah, it's really important. In the break, you were talking a little bit about your community outreach and things that you do to involve people and keep them healthy. Could you speak more on that?
Yes. Well, like we said, health prevention is big to me, especially in the community where I've spoken, like a lot of the floor nurses, the charge nurses have asked me to speak on health issues with men in their churches, and they've had health fairs where we talk about some of the health issues that affect communities as far as like the screening for men, prostate, getting your colonoscopies for women, mammograms, pap smears, things like that. Things that, we know we should do, but we don't do it because we're asymptomatic. If it's not bothering me, I don't go to the doctor.
Right.
I think that those are big. So I try to reach out to the communities with the churches and health fairs and any speaking event. Also do mission trips with some of the other trips. We go overseas to Haiti, in other countries, Jamaica, where we go and we volunteer to help. I think that's big giving back. Being that I'm Caribbean descent, so I think that that's always good going home and just seeing myself as one of those children, in need of medical attention, things we take for granted. And because we're in a unique position where we work, because we get a lot of patients that are transported from, say, on a cruise or on a vacation from a third world country, but they could be from Canada, they could be from Washington State or California, and they come to our facility, and they tell us what it's like over there in those hospitals and how they're not equipped to handle the severity of some of those issues that they may have. And they then appreciate the fact that when they come to our hospital, how the staff and how attentive we are, and to a stressful situation where you're on vacation on the boat, and then now you have to worry about getting home. Now you have to worry about your luggage, or if your spouse is still on the boat, and how we're going to arrange. So we try to make a tough situation as comfortable as it is. We try to ease their mind, and we partner. We have a good plan with our social workers to help them transition. And if they need anything, we do that. And that helps. That makes me realize that even though we have all the nice machines and everything we have here in this country, that there are places in the third world country and other places that don't have what we have. And
right.
A lot of time, I was stressed with my patients, health prevention, because we cannot take for granted what we have here, and that we should go to the doctor's office, even if there's nothing wrong, just for a routine checkup. And I also emphasize to people that, as far as cancer, when that's concerned, it's very silent. You never know when it's going to happen. And that's why having these annual exams and checkups goes a long way in preventing something tragic.
Very true. Very true.
It's so nice to see doctors with such a huge heart. They're really committed to the field. It's very sweet.
That's fantastic.
It's wonderful.
So we're getting to the close of our show. Is there anything you want to tell our audience members or viewers as well about your practice and something they should know as far as advocating for themselves?
Well, I want to say this is back to an earlier question you posed, how we differ. I think as we were talking, I realized there are challenges in medicine, and communication is key. Any relationship, anything in life, communication is key. Mm-hmm. And I want to say I had a situation where there was a patient who was discharged from our service to a home health agency. And I think the patient was giving some antibiotics and was to follow up with his primary. But, there was a gap as far as like loss of communication, because the primary did not want to own the responsibility of managing the antibiotics or his labs because he or she felt that, well, we didn't write the medications, and so why am I following up? And the reason I'm bringing the story up, because I feel like this is where I feel like we're needed, because if we're going to discharge a patient and with a home health agency, whether it's for continuous infusion of IV antibiotics or anything, we've seen those patients, we know what happened, and we can easily step in and comfortably manage that patient for that time being. And that way, there's not that loss. Now the patient's wondering, what do I do? And then, of course, the home health calls us and we do what we can. But without that office, I really can't follow up with his lab work and everything else he may need and adjust the medication. So I think this is a problem that has more often where we discharge a patient, but then their primary doesn't want to kind of take the ownership as far as following up. With that, I think we can step right in and manage that, even if their primary doctors don't want to.
That's wonderful. You've been watching HomeTown HealthCare Show, and I'm Yolanda Santana. Thank you, Dr. Francosi, Dr. Mikkel Zelfman. Thank you, Trilogy Home Healthcare, Teresa, Jackie, Brian.
Thank you very much for being our guest tonight.
Thank you very much for having us on your show.
Happy holidays
Yeah.
and Happy New Year.
Thank you.
Thank you.
Thank you.
All right.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com.